show, we are going to talk about a disease that affects 240 million people in the whole world and kills more than 780,000 people every year in the whole world, according to data from World Health Organization. Now tonight on the show, I have a specialist or a doctor who is here to give you facts. On health facts, we only give facts. Doctor, the data says 240 million people are affected with hepatitis B, and 780,000 people die every year. What is this disease?
Of course, as you have observed, hepatitis B is a very serious disease. And like you've said, data actually reveals that it kills a lot of people worldwide, not just in Uganda here, but worldwide. Now, hepatitis B, this is a virus. So it's not a bacteria, it's not a condition, it's a virus, just like HIV, okay? And it's a virus in a group of hepatinoviruses. But what is important about this virus is that it is highly transmissible. It can be transmitted from person to person. So it is a virus, and being a viral disease means it is highly replicating. That's number one. Number two, it may not have curative treatment per se. So we may not be able to cure this hepatitis B virus when it attacks you. However, we can control it, we can modulate it so that you can live a happier life.
You just talked about like it is transmitted through, how is it transmitted from one person to another?
Blood containing body fluids. So that means through sexual contact it can be transmitted, through transfusions it can be transmitted, through use of sharing sharps, like in intravenous drug users. You know, these people prick themselves and then from one person they prick to inject, you know, we call them IV, intravenous drug users. Of course that is a common thing in the Western world. In Africa here, not yet as common a method of transmission. However, this transmission, we can't forget mother-to-child transmission.
Some individuals are chronic asymptomatic carriers of hepatitis B, but the hepatitis B virus is most often spread by sexual contact with an infected partner, needles shared by intravenous drug users, contaminated blood products. Other means of transmitting hepatitis B include open skin lesions such as those due to impetigo, scabies, and scratched insect bites. These can be a source of the hepatitis B virus under certain circumstances. Also, anyone who works in certain healthcare facilities is at risk because they may come in contact with infected individuals or they may work with infected fluids. These healthcare facilities include dental and laboratory settings. Blood that has been donated is now screened thoroughly at blood donation centers in most developed countries, but receiving a blood transfusion in some areas of the world may still be risky. Cosmetic procedures, tattooing, or body piercing can result in a hepatitis B infection if the needles and equipment used are not properly sterilized. Be sure the person or facility doing these procedures practices proper hygiene and sanitation.
So very, very important, mother-to-child transmission, because when a child contracts hepatitis B, as I will tell you later, the chances of them fighting off that infection are very low compared to hepatitis B contracted as an adult. 95% of people who contract hepatitis B as adults actually fight off the infection. And they clear it totally. It disappears from the blood. That is 95% if you get it as an adult. However, if you get it as a younger child, 5 to 6, about 30% can clear that infection. And if you get it as a neonate, as a newborn from your mother, only 5% can clear that infection. Okay? So that means mother-to-child transmission of this hepatitis B is very, very critical. And that's why all women, when you go for antenatal, they always check for hepatitis B. Your doctor must check whether you're carrying hepatitis B, so that more precaution will be taken during delivery of your child. So, however, this is important because some people fear that is hepatitis B transmitted through handshakes, you know? So it's not transmitted through shaking hands,
hugging.
you know, hugging, you know, sharing a shirt,
Okay.
you know, it may not be transmitted through there. However, it's about body fluids which contain blood.
So even saliva, kissing, and all
Okay,
that?
saliva is tricky.
Okay.
Lots of literature will say kissing will not transmit hepatitis B. However, some literature says a little bit of the virus may appear in the saliva, but kissing is not a known mode of transmission because there's no blood. Remember I said body fluids containing blood. So if you have an infection in the gums and you're bleeding and you kiss, you're going to transmit this hepatitis B virus.
Okay.
But if it's a pure, clean mouth with just saliva, it's not going to transmit. Yeah, unlike HIV, for example, HIV cannot be transmitted through kissing ever, because for it, even if you had a bleeding, you know, gum somewhere, the moment that blood mixes with saliva, the virus is kind of dead, if we can use that. So it cannot be transmitted. Yeah, but with this hepatitis B, if you're bleeding and that blood comes in contact with the saliva and then we kiss, then that can be transmitted. So that's why literature on kissing is a bit contradicting, yeah, because of that. If it's a pure clean kiss, there's no transmission. But if it's blood stained, then it can transmit hepatitis B.
Okay. Doctor, I've had cases of people, chronic carriers and others are not. May you please clarify more on that?
Of course, hepatitis B is something that is feared. But what is important is we need to look at what happens when you're exposed to hepatitis B. So when this virus comes into your body, it's a virus, remember, which has particles. So it has a surface particle called hepatitis B, surface antigen. That is the first particle that will show in your blood. And at that point, your body will start fighting endlessly, okay? And it will fight this virus. Now, like I told you earlier, 95% of adults, so now let's focus on adults. So 95% of people who contract hepatitis B as adults will start noticing, their bodies will start noticing that surface antigen. So their bodies will fight. And at a certain point, when this surface antigen is detected by your body, and that is, by the way, the point at which even the lab test will turn positive for this virus, okay? It's detecting for the surface antigen of this virus. Remember that the body, during fighting, is going to make antibodies which are fighting against the virus, okay? So, for these 95% of the people, of individuals who fight off this infection, they will automatically stop the infection. So the virus will stop replicating and the virus will stop. And at that point, you are okay. Okay? Now, the other 5%, the virus will continue replicating. So that means your immunity fails to fight this virus. And that is the state where we bring in chronic carriers. That means your test will continue to be positive for a much longer time. Okay? However, so many things happen even when you're a chronic carrier. Okay? One is that this virus will start encroaching onto your liver. Okay? As we know, this virus likes hepatocytes, which are liver cells. This hepatitis B, the virus continues to replicate and it continues to cause havoc. At that point, when it's attacking the liver, there's what we call the alanine transferase. That is the enzyme that shows the liver is damaged. So your alanine transferase will continue to elevate. It will go higher and higher and higher. Okay? So that is the point when we think we bring in so many other things like treatment and so on and so forth. However, when your body fails to fight the hepatitis B, then you go into what we call a chronic carrier state. But let's look at when this virus has just come in. What signs are you going to have? You're going to have a fever. Okay? You're going to have general body weakness. You're going to lose appetite. Then eventually your eyes are going to turn yellow. Your urine will turn yellow, deep yellow. The skin may also turn yellow, meaning that this liver is seriously damaging your liver. Okay? So at that point, that is what we call acute hepatitis B infection. So from that acute hepatitis B infection, some people will fight it off, others will go into chronic carrier state. But these signs I've said may not come. So you may actually get hepatitis B today, your body will fight, you will not notice. So the fevers will not come, the eyes will not turn yellow, nothing will happen, but your body will keep fighting. And still, you may resolve or you may progress to chronic carrier state. Of course, the biggest advantage with checking yourself for hepatitis B is that when you are a chronic carrier, then you know that you are at risk for 1, liver cirrhosis, which is liver damage, but 2, liver cancer, called hepatocellular carcinoma. So that means people who are chronic carriers must avoid alcohol, because then if you take alcohol, you're having 2 problems which are going to cause you liver damage. So you're having the hepatitis B and you're adding alcohol. So it's important.
Let's explain the symptoms and then who's a carrier now. Who is at risk? Am I at risk of getting hepatitis B? Are you at risk too?
Thank you very much for that question. And it's a good one because everyone is at risk. All of us are at risk. However, there are those who are at a higher risk. All right? For example, neonates. Okay? Children are at higher risk because they play with friends, they injure themselves at school. Issues of blood mixing at school is very, very common because of children. So children are highly at risk. Good enough is that our Ministry of Health guidelines for immunization already thought about this. And all children, if you take your child for immunization, they have immunized them against hepatitis B. Okay? So you don't have to worry. Okay? Because the ministry knew that the children are at higher risk. Okay? So outside that childhood bracket, we have drug users. Okay? People who share sharps at higher risk. Of course, the promiscuous people, because if you are, I told you that this is also sexually transmitted like HIV. So promiscuous people are at a higher risk. Yeah, but generally, we are all at risk for this disease. Everyone can contract this disease. Yeah, and apart from those who have been vaccinated.
Doctor, how can I know that I'm getting or I already have hepatitis B?
Now, a diagnosis of hepatitis B is a very easy one. It just takes a blood prick. So we take off your blood and we check for the viral particles. So we check for the particles themselves. So the most common one is what we call the surface antigen. So we check for what we call the hepatitis B surface antigen. And once that one is positive, it confirms. Okay? However, there is what we call a core antigen. Okay? And this core antigen is called the hepatitis B core antigen. Now, this one comes in a bit later. But the hepatitis B surface antigen can be detected fast, as early as within 30 days of contracting the infection. You can tell. Then the core antigen comes in a bit later. Okay? Now, the core antigen is very important because we can also check antibodies towards that core antigen. We call them IgM, IgG. Now, the importance of that is that for it, it can tell us who is fighting the infection and who is not. So, the hepatitis B core antigen can be detected. However, the antibodies towards the core can help us detect who is fighting the infection and which body is controlling the infection and which one is actually failing, chronically leading to the chronic carrier state. So, checking for the hepatitis B surface antigen just confirms that you have hepatitis B. But it may not tell you, one, how is the body reacting to it? Is the body fighting? Is the body winning the battle or not? Or is it actually losing the battle? Okay? So that's why we go on to look at the hepatitis B core antigen and its antibodies. Alright? Yeah. But also we go on to look at your liver function. Because the liver function also helps us guide us whether you're actually fighting the hepatitis B or not. So we look at the alanine transferase, which is a liver enzyme. Very, very important for showing who is failing to control the hepatitis B or not.
So, doctor, after being tested for hepatitis B, what is my next step?
Treatment of hepatitis B. One, not everyone requires treatment for hepatitis B. Okay? Not everyone. So there are guidelines that determine who requires and who does not require hepatitis B treatment. But then also it's important to know that there is no actual treatment to stop hepatitis B, to cure.
So it's not curable.
This treatment is not curable. It is to stop viral replication. Okay? For example, like HIV. When we give you ARVs, we are not saying we are going to cure you. But we want to stop this virus from replicating so that it is not going to cause damage. So the aim of hepatitis B treatment is pretty much similar. Because like I said, this is a virus, so it cannot be cured. Okay? So we are not going to cure it. But we can stop this virus from replicating such that, one, you are not at risk of liver cirrhosis and liver cancer in future. If this virus was left to keep replicating the way it wants, then chances are very high that you are going to have liver damage and liver cancer eventually.
And you can die.
And you can die eventually, of course. So, like for example, literature shows that 50% of people who have chronic hepatitis end up with hepatocellular cancer. So that's why treatment is very important. Okay? So, who gets treatment and who doesn't? So we must look at the liver enzymes. So once we realize that your liver enzymes, they are called transaminases, are high, they are not coming down, then we'll know that you're losing the battle. So we need to bring in treatment.
Right.
Secondly, if you're immune compromised, and there are so many reasons you can be immune compromised. Of course, we know one of them is HIV. If you're HIV positive, then we have a regimen where we call it HIV, hepatitis B, co-infection. If you have both, then you are in trouble, so we need to treat you, okay? Yeah, and then other issues, for example, if you already have liver cirrhosis, then we need to treat. If you have hepatocellular carcinoma, then we need to treat. So, the treatment is very variable. However, there are a few drugs that have been regulated, they have been recommended for treating hepatitis B. One of them, these are actually ARVs, all right? One of them is tenofovir, very, very good for treating hepatitis B. We normally combine tenofovir with lamivudine. These are all antiretroviral drugs. They are also used for treating HIV, okay? So if you see your doctor treating hepatitis B and is giving you ARVs, please don't worry. So we use tenofovir, we use lamivudine, and we have newer ones which may not be available in Uganda, like entecavir. Very, very wonderful drugs. They bring down this hepatitis B and they stop it from replicating. Hence, you don't have issues. You may stay positive for the infection, but no problem. Okay? Now, there are also drugs we call immune modulators. They are very good. However, they are not available in Uganda. These immune modulators include interferons. Yeah. So these ones, they are given as injections once weekly, you know, so they modulate the immunity so that it can actually fight the virus. Yeah. So those are some of the available treatments. However, duration normally between 6 months to 12 months. That is the average. But all that depends on the other factors around, like how is your liver reacting to it, how are your transaminases, the liver enzymes that I mentioned earlier, you know, what other comorbidities are there, you know, are you HIV positive, are you diabetic, you know, yeah. But roughly between 6 months to 12 months, we have stopped this virus from replicating using those drugs.
Okay, I've heard about vaccination. Who is vaccinated and who's not vaccinated?
Wow, thank you very much. Now, vaccination is not a treatment. It's a prevention.
Okay.
And vaccination for hepatitis B has been around since 1991 in the US.
Okay.
This virus was first discovered in 1966 by scientists in the NIH, National Institutes of Health in the US.
Okay.
And that was around 1966. And by 1980, the genome, the whole virus had been known totally. So by 1980, the vaccine trials began to try how we can vaccinate against hepatitis B. By 1991, the first vaccine was available in the US. Yeah. So even here in Uganda, we vaccinate against hepatitis B. Okay? One, all children are vaccinated against hepatitis B. So you remember your children, you take them at at birth, then you take them back at 6 weeks. So at 6 weeks is when we begin vaccinating. So we give them at 6 weeks, where we give the DPT, then Hep and Hep B. So we give them again at 10 weeks and at 14 weeks. So if you adhere to that schedule of vaccinating your child, then you don't have to worry. However, what happens? This vaccination normally wears out by around 10 years of age. So from 10 years of age, we need booster doses. So here we focus mostly on people who are at a higher risk. For example, doctors, because they are going to be seeing patients, medical workers, all health workers. We focus more on those, and also people who may think maybe because of their work they are more at risk. Okay, but other factors remaining constant. Everyone should be vaccinated against this virus. Okay, and the schedule is very simple. There are only 3 shots. Okay, you get one that starts, then after another 1 month you get another, and then a booster dose at 6 months, and you're covered.
Doctor, how common is hepatitis B in Uganda, and in your final words, what advice do you give to people who are living with hepatitis B and these ones who are not aware they actually have hepatitis B?
Now, hepatitis B is very, very common in Uganda. We don't have actual statistics from the Ministry of Health. However, it is very, very common. Here in Uganda, in the Arab world, very, very, very common. So what I advise people is, one, please go into any health facility, check yourself, okay? Check where you are, where do you stand. And like we said, you can do the hepatitis B surface antigen, which is very available the whole of Uganda, okay? Then if you have that, then you can go to higher labs where we can do the hepatitis B, COA, okay, antibodies, IgG, IgM, and also look at what we call the viral load. Yeah, so then we determine, okay, if it's there, is it replicating? How bad is it? How is your body controlling it? And then eventually start on treatment. However, if you're a chronic carrier, then you must avoid alcohol, because alcohol is a big, big, big no. Alcohol is going to cause liver damage, and it's going to combine with hepatitis B, and then the liver is going to die. Okay, yeah. So with that, I think what is important is people should check themselves, just like we check for HIV. It's a quick test, 10 minutes, you know your status for hepatitis B. Pregnant mothers should always endeavor that they check, so that we don't pass this on to our newborns. Yeah.
Thank you very much, Dr. Francis. I'm looking forward to hosting you next time.
Thank you very much. Okay. I'll be waiting.
Okay, have a good night.
Good night.
If you missed this show, you've missed quite a lot. On the show we had Dr. Francis from Lifemate Diagnosis Center here in Ntinda, and he taught us about hepatitis B and how you can prevent it and the treatment. So you can catch the repeat tomorrow if you've missed at 11:30. And you can go on our Facebook page, because we have this information there, and check it out. You can also question us and we'll be able to answer. I've been your host, Mary. Until next time, have a good night.